Hi, good morning, everybody. I'm Missy Hughes. I am CEO and Secretary of the Wisconsin Economic Development Corporation, and I'm glad to invite you and have you join us for our 5th in our COVID-19 CEO Leadership Series webinars. So it's hard to believe we have been working on this for 5 weeks. Having these webinars every week, we've had just a tremendous learning process through this whole thing, and we've been so lucky to have CEOs and other folks from major companies and small companies and small businesses join us so that we can learn about what is happening within the business community and within the medical community around COVID-19. I'm really pleased to have been able to work on this series with our regional leadership council. So all around the state, we have 9 different regional economic development organizations that WEDC works very closely with, and they are spread out around the state so that we can get a real look at the regions and understand what's happening in each of those regions, but then work together as a state, moving our economic strategy forward. So we've got Visions Northwest, Momentum West, Seven Rivers Alliance, Prosperity Southwest, Grow North, Synergy, Madison Region, the New North, and Milwaukee 7. And by all working together, we can bring you this great information and really learn from you also. I invite you to ask questions in the question box. We have the slides available for you to view after this webinar. We're also recording the webinar so that you can review it. We've got the past webinars are available. I went back and looked at last week's webinar because we had some great information from Dr. Raymond's colleague at the medical college. So there's just really good information and really good sharing happening. So I really appreciate that. You know, 5 weeks in, we've had a lot happen. We are in the midst of working on the Badger Bounce Back Plan with the governor's office at WEDC. Our role is to find this balance as we move through this process between public health and the economy. And you know, the title of this is Balancing Lives and Livelihoods, and that's really where we all find ourselves, and we're all working through that. So our part of that at WEDC is called Wisconsin Ready, and you can go to the next slide, Eric. We have 3 prongs to our Wisconsin Ready program, and this is really about getting businesses ready to reopen, to gain momentum in the economy as we go forward. And before we dive into our panelists today, I just want to alert you all and announce that today at WEDC.org, we are launching a series of guidelines for businesses to be able to think about, what do I need to be doing in my house to get ready for reopening? How do I take care of my employees? How do I take care of my customers? So we've been developing this set of guidelines. We've brought in guidelines from all sorts of different industries. We've looked all around the country for all these different protocols that are being built, and we've summarized those. First, we have general guidelines for businesses to consider, and then we have specific guidelines for a number of different industries, and we'll keep building on that. But today we're seeing restaurants and retailers and manufacturers, professional offices, builders, hotel and motel operators, and personal care services launching on our website. I'm going to give you the website, and hopefully we can send it out also afterwards. It's WEDC.org/reopen-guidelines. You can also get to it from our homepage at WEDC.org, but we're really excited. There's been a lot of work put into this. We've worked very closely with DHS. So as we've gotten the guidelines, we've looked at them, we've sent them to DHS, we've worked with DATCAP and the Department of Tourism to gather these guidelines, make sure that they're industry focused and thinking about what actual businesses are doing. I continue to be so impressed with how businesses are stepping into this space of dealing with COVID-19 and really thinking about their workplaces. And we'll hear more about that today from our panelists. But you know, businesses are really coming to this challenge and joining it. And you know, we're ready to share that information with these protocols out to all the businesses in Wisconsin. So we're ready when the time comes to reopen and get rolling. So that was just a piece about what we've been working on at WEDC. We have, once again, a great group of panelists joining us today, both from the medical and the business community, to help us understand what is happening and the impacts of COVID-19. So Dr. Raymond is joining us from the Medical College of Wisconsin. Dr. Raymond has been my partner in arms through all of these webinars, and I'm really glad to be able to once again hear his thoughts and to see how this has all been evolving over the past few weeks has just been very informative. Bernie Cheri from Ascension, Wisconsin is joining us to talk with us about the challenges that Ascension is facing and the changes that Ascension is making. John Kreul is the VP of Supply Chain at Amcor, and he is joining us to talk to us about what Amcor has been experiencing. And then Buckley Brinkman from the Wisconsin Center for Manufacturing and Productivity. I'm pleased to have Buckley here to talk to us about what he's seeing in the manufacturing community. So before we get started, we have a short poll that we'd like you to launch. We'd like you to answer for us. As we did this last week, we just want to understand where are we thinking and how are we doing as far as our businesses and organizations go. So what do you expect for your business in the next 90 days? If you could select one of those things, we did this last week. We got some interesting answers, and I'd be interested to hear quickly while we're waiting for the results of this from our panelists. Bernie, if you were to answer this from your organization's perspective, what would you pick?
We would be recalibrate, reorganize. So as we start to reopen some of our services, we're going to be living in both worlds. There's still going to be some COVID-19 in our communities. So we need to care for those that get diagnosed with COVID, as well as be able to provide essential services. So we're in the middle. We're recalibrating and reorganizing. Yeah,
that's great. John, how about Amcor? Where do you think you would land on this?
For Amcor, I would probably answer recalibrate slightly for changing customer needs. We've had impact and we've had to adjust, but I would say slightly.
Okay. And Dr. Raymond from the Medical College?
Yeah, thanks. I think we're probably doing a little bit of recalibration, reorganization, and even some redesign.
Covering the gambit, depending on probably your different parts of the organization. And Buckley, what would you say from a manufacturing perspective, from who you're talking to, what would you see as far as what manufacturers where they would be landing on this?
Yeah, with the people that we're seeing, they're ending up in the middle of the scale. We're not seeing too many people who are making dramatic changes right now, but they are getting ready for a fast restart.
Got it. Perfect. And so I think we're ready to see the results. And, what do you guys think? That sounds pretty much in line with what you all just described. We've got 81%, if my math is right, which really could be not, right about in that recalibrate, reorganize piece. Great. Okay. So Dr. Raymond, we have Dr. Raymond for about 15 minutes. He is just on the circuit. Dr. Raymond, I actually was thinking as you started, you're probably ending the day with a sorer throat than I am. I feel like I'm just talking a lot, and at every turn I see Dr. Raymond sharing his good thoughts and his advice. So I will turn it over to you for kind of an update on what you're seeing and how you're thinking about workplace safety and those pieces. So let's dive in.
Thanks, Missy. Glad to be back. It's really an honor to be with such a wonderful group of people. And good morning, everybody. This first slide summarizes the various indicators of COVID-19 as of yesterday, and I'll run through these very quickly. The doubling time for COVID-19 continues to stretch out in Wisconsin now to almost 14 days, according to the Medical College of Wisconsin Institute for Health and Equity. And the daily growth rates over the last 7 days have been pretty stable at 4.3%, again, according to the Medical College of Wisconsin. There were 314 positive tests in Wisconsin yesterday, with 53 in Brown County and 104 in Milwaukee. And there were 5.7% positive tests in Wisconsin, according to the Wisconsin Department of Health Services. COVID-19 diagnostic testing capacity has continued to increase significantly over the last 2 weeks and has been stable the last 3 days between 13,800 and 14,800 tests according to DHS. That's our capacity. ICU and ventilator capacity is stable, and it is adequate according to the Wisconsin Hospital Association. And personal protective equipment trends are improving and stable, with the most critical shortage of gowns, but still not really all that bad compared to where we were a few weeks ago. Now, not shown here, the counties with more than 100 cases of COVID-19 are Brown County, Dane, Kenosha, Milwaukee, Racine, Rock, Walworth, Washington, and Waukesha. And of those counties, the ones with the highest numbers of cases per 100,000 from highest to lowest have been Brown, Milwaukee, Racine, Walworth, and Rock. Next slide, please. Now this slide shows the updated Badger bounce back gating criteria. A green circle means that the gate is open, and a red circle means that the gate is closed. The downward trajectory of influenza-like illnesses is shown in green, so that gate's open. But the downward trajectory of COVID-19-like syndromic cases remains in red, so that gate is closed. We have a downward trajectory of positive tests as a percentage of tests administered, which continues to remain red, but the trend looks pretty good actually. And I would note that as of yesterday, we administered over 5,000 tests, which was a new high, but still we're not filling up our capacity. The next two gating criteria are new criteria for hospitals. And these were developed in consultation with the Wisconsin Hospital Association. And these are to be able to provide non-crisis levels of care and to be able to test all symptomatic clinical staff per CDC guidelines. Now, I expect that we should have initial results for these two gates later today. I actually looked just before we started to see if they'd been updated. And I do expect that these will turn green either today or sometime next week. And although there was insufficient data for these, again, I remain optimistic. The final gating criterion would be a downward trend of COVID-19 infected healthcare workers. Currently, this is in red, but I also expect that one to trend favorably. Next slide. This slide highlights what Missy's been saying for these last 5 weeks, that collaboration is essential for all of us to be successful, to bounce back together. We need to acknowledge that the health and the economy really are inseparable, and we don't need to make either or decisions. We can balance lives and livelihoods. Business, government, healthcare, and public health really are stronger when we all work together. And going forward, we're going to need to enhance and coordinate our testing, detection, contact tracing, and isolation of infected individuals if we want to get on the other side of COVID-19. And in order to do that, we need to mitigate the spread in public places and workplaces, and we need to protect the most vulnerable. And in that regard, I'm very encouraged by our state's very recent efforts to secure testing capacity at scale, to focus on long-term care facilities and workplace spread, and provide testing to under-resourced minority groups. Next and final slide, please. This slide focuses on workplace health and safety principles that Missy said earlier in the meeting that were being developed by WEDC. And we do need to prepare and protect our employees and visitors, our customers and communities, and our facilities, our places and spaces. Now, this visual and the framework were created by Dr. Laura Cassidy at MCW in collaboration with the Metropolitan Milwaukee Association of Commerce, and it incorporates best practices from the CDC, World Health Organization, and OSHA. And I'd point out that this framework also has elements that are very similar to the Wisconsin Manufacturers and Commerce proposal. So a lot of common thinking there. And the framework also can facilitate cross-sector collaboration to benefit all of us in Wisconsin. And it does highlight our shared responsibility for doing all that we can to protect the health and safety of our people and to responsibly restore our economy. And with that, I'll turn it back over to Missy.
Thank you, Dr. Raymond. So we've got a couple questions, and I think we've got a couple minutes to ask them. So first off, we have a question for Portage County, and Portage County is doing expanded testing with the National Guard Monday and Tuesday. So I'm guessing our number of cases might spike. How is that taken into account across the state with all of the data?
Yeah, that's really a good question. And when you have increased testing capacity, you're going to have increased cases. And I think part of what the governor and the Banter Bounce Back Plan is trying to do is mitigate that by measuring the % positive tests, so that we don't have an artifact of increased testing.
Then we have a question, and I'm going to add a little because I can, because I'm the moderator. Does testing positive for COVID immunity mean the disease is inactive? And that you would no longer test positive for COVID. So I think that goes to the question of the serologic testing for antibodies. And I'm wondering if you can tell us anything, an update on that question.
Yeah, thank you. So right now we're primarily doing diagnostic testing, which is for the RNA of the COVID virus, which is associated with either an active or a resolving but not completely resolved infection. The serological test, what I have to say is most of the ones that are on the market and that were given emergency use authorization by the FDA, in my opinion, are pretty much worthless. They have a high positive false positive rate. And when you have a low prevalence disease, that can lead to an extreme exaggeration of the number of cases in your community. The Abbott and the Roche diagnostic tests that use serology are really pretty good, and those are going to be rolled out very shortly. And so I think that'll help us. So just to answer your question, in the early phases of the disease, you'll have a positive RNA test. As you begin to resolve the disease, those RNA particles will go away. And then you should start to be able to detect the immunoglobulins. First immunoglobulin M, and then 2 weeks out, immunoglobulin G. So there is an overlap when you could detect the virus and some immune globulins. We still don't know yet whether having those immune globulins or the immune response gives you real immunity to COVID-19, and that's something we'll find out in the months to come.
And are we seeing any information on that from other countries that have experienced COVID-19, whether it's China or France or Italy? Do we have any concrete information on whether or not you do have immunity going forward?
No. Although early on people were concerned that folks might have been reinfected, I think basically the consensus right now is that we have no documented reinfections. So that would suggest that there's some degree of immunity. And also there are some preliminary studies that show the use of convalescent plasma may have beneficial effects. And if that's true, then there should be some immunity.
I see. And then the piece I wanted to add is on the testing, is there a rate of false negatives that we need to be thinking about as we're doing more and more testing?
Yes, although the PCR test continues to improve, it really depends on when during the infection you're tested. For somebody that is mildly symptomatic, they may have a very low viral load and that wouldn't be detected early on by the PCR test. And that's why in many cases, if there's a negative test but a high index of suspicion, there's a recommendation that you retest again in 2 days.
Got it. That's super helpful. Thank you. So let's just touch on, I think that almost naturally leads to this issue that, as we're learning about the testing, as we're learning about the serologic testing and, the value of that, it's critical that we keep in mind these safety principles. And one of the questions that we got is, there's a number of businesses that are it feels like they're crowded. It feels like their employees are not using PPE. How would you think about making sure that we have an agreement among all of us in Wisconsin that we're participating in these safety principles and these guidelines?
Well, that's hard to do because there are people that object based on their civil liberties and they're not really going to cooperate. We've already seen that. And that's a particular challenge in the workplace. And I don't have a good answer other than that we need to do our best to educate the public and our employees that it's to their benefit and the benefit of the people that they love and work with to exercise social distancing principles. And we need to set good examples as role models.
Great. I agree. I mean, I think that it's something that we all need to take up. We're all in this together. And we need to be working on that. I was driving home yesterday and I noticed line of 4 kids wearing bike helmets. And I thought, there was a time when I bet a bunch of us were young, we would never wear bike helmets. And now if you see a kid without a bike helmet, you're like, well, your parents are not, they don't care about you. So we have to get to the point where masks are the same as bike helmets, I guess. And, my kids won't get on a bike without a bike helmet. So there you go. Well, Dr. Raymond, thank you again for joining us. I really appreciate it. We are going to move on to our next panelist, which is Cheri. Bernie is the Ministry Market Executive from Ascension, Wisconsin, and a Senior Vice President at Ascension. And so, Bernie, if you could share with us what Ascension has been experiencing, what you're thinking about as far as workplace safety, changes you're making, the floor is yours.
Thank you, Missy. And I want to thank Dr. Raymond, as you stated early on, Missy, his leadership. I mean, he's been very engaged and present, and just thank you, John. As a physician and a scientist, really appreciate your leadership as we've worked through this as a state and across our community. So thank you. I wanted to give a shout out. This week is Nurses Week, and I know that all our communities have recognized our clinical leaders, our frontline leaders. And so if you have a family member or friend that's a nurse, give a shout out to them. This picture here is from our Howard Young Medical Center up in Minocqua. Respiratory therapists, radiologists, nurses out there. Folks put signs up here recognizing the healthcare heroes. Next week is Hospital Week. And so if you know somebody in the hospital industry, just give them a big thank you. Next slide, please, Eric. Just to give you an overview of Ascension, Wisconsin, we have 24 hospitals and about 150 clinics and other ambulatory sites across the state, about 16,000 associates from Racine all the way up to Eagle River. We're also part of a national health system. We have facilities in 20 states. This was a huge advantage for us here in Wisconsin as we started to deal with COVID. Working as a national system, processing the guidance that was coming out from the CDC and getting this out into the markets quickly. We actually had 3 areas. We have facilities in New York, we have facilities in Michigan, facilities in Illinois. And so we were able to tap into what was happening as COVID started to break out and become a hotspot in those areas and learn quickly and bring this into Wisconsin. We immediately stood up as COVID started to hit our community, we stood up our incident command, both statewide, and each of our facilities, including our clinics, created incident command as we responded as one statewide network. So that was a huge benefit in several areas. Number one was keeping our associates safe as we learn more about COVID-19 and how to deal with it as it was coming into our facilities. Our number one priority was keeping our physicians and our associates safe in our facilities. And so we're fortunate within Ascension to have the resource group, that is our group purchasing organization within Ascension. That team did a stellar job and continues to do a stellar job getting us the PPE needed to keep our frontline associates and really now, because we've moved to universal masking in all our facilities, so all our facilities safe within our organizations. And so right here, this picture you see in front of us is actually remote testing sites. And so as we were preparing our hospital facilities and our clinics, and I'll speak to our clinics on how we adjusted as a business to continue to take care of patients that were non-COVID. Here's a facility up in Tomahawk. We put up 15 remote testing sites early on so that our patients could have access. If they were symptomatic, they could gain access to testing across the entire state of Wisconsin. We also opened up 10 respiratory clinics for patients that were having symptoms, and so that was critical. And one of the other advantages of our statewide system, we have facilities in rural, urban, and suburban markets. And so as we were seeing various breakouts, we know Milwaukee, where we have 7 facilities, was one of the hot spots in the states. We were able to actually move resources around where the needs were, whether it would be ventilators. We actually moved staff, and certainly we were looking at par levels of our supplies of PPE, and we're able to move it where the need was. And our teams did an outstanding job. In addition to this, I want to emphasize one thing that Dr. Raymond, there has been a ton of collaboration. As we all developed surge planning, as we looked at what was happening across other states, the healthcare systems, we actually reside in 4 of the HERC regions, HERC Region 2, HERC Region 6, and HERC Region 7. And to each one of the healthcare systems, the CEOs, the chief medical officers, chief clinical officers, the level of collaboration to actually come together and respond, to share best practices, to talk about our readiness, to talk about our surge planning. Just a huge thank you to the healthcare community and the healthcare sector. We certainly work with our public health officials, our government officials. You know, through my lens, I saw a community of leaders come together, really bringing their gifts to the table to respond to this COVID-19 response as best we could. And I give a big shout out to really all leaders in our community, as whatever role they played, I just saw hyper engagement around coming together as a community and doing the best that we can. And I think as we look to reopen, I see that same spirit in Wisconsin. And so just a huge shout out there. So, you know, what was it living through COVID? Number one, our position was we already had our frontline teams, our physicians, our nurses, many of our supports dealing with the stressors of COVID. Our organization made a commitment that we were going to have pay continuation for all our associates as we work through this COVID-19, and that's been our commitment and continues to be our commitment. We didn't want to provide additional stressors to any of our clinical teams as they were already dealing with the stress of COVID-19, and I'm really proud of our organization for taking that position. But I also want to give a shout out to when PPE was top of mind for everyone. Our resource group did a great job, but we also saw amazing leadership from organizations within our community that either donated PPE or actually modified their plants to actually develop, you know, masks and other PPE gowns. And just a shout out to one who created an innovation mask that we purchases is Alan Edmonds. Just want to thank Alan Edmonds for their innovation and turning that around. And I know John's going to talk about what his organization has done. So just a shout out to everyone that provided that support. As far as current state, Missy said, where are we now? And so we are preparing and shifting and adjusting. So as I said before, we're recalibrating and we're reorganizing. And so if you remember back when we were responding as a healthcare system, one thing that the task force, the coronavirus task force, the Surgeon General asked healthcare systems to defer elective procedures and really focus on only those that were urgent. We wanted to protect not only our community, the governor put out the Safer at Home. We also wanted to protect our associates. And so we had many of our clinics move from actual taking care of patients in the office to a virtual platform. Pre-COVID, we were seeing about 200 virtual visits a week. And since COVID, over the last 6-7 weeks that we've been dealing with the COVID response, 8 weeks now, we're up over 50,000 virtual visits. We have 2 platforms. One is virtual urgent care. So that's a platform, if you have an urgent need, you can get access to a physician. Pre-COVID, we had 10 of our providers that were doing it 4 hours a day. Now we have 431 of our providers that are trained and can respond to virtual urgent care needs. We also stood up virtual provider office visits. So folks in the community could actually connect with their physicians. You know, pre-COVID, we didn't have many physicians that were actually using that platform. You know, since we didn't have our clinics open, we were able to train 920 of our physicians to actually be able to use the virtual provider office platform. And so as we've been living through COVID, we've also allowed our patients to have virtual connections to their physicians, whether it's primary care or specialist. We also use those platforms to support our remote testing sites. And so our 15 remote testing sites, we had a hotline. For those that had a physician, they could go direct to their physician. For those that didn't, could call the hotline and we would get them connected to a physician and then get them the test they need. That continues to be live today. So what are we doing as we look to reopen? 160 clinics across the state, is to get them ready for those patients that want to continue to connect with us virtually. That platform will be available. For those that want to come into one of our primary care or specialty clinics, we're setting those up to be as touchless as possible. So if you think about registration and actually paying your bill, masking within our facilities, we've gone to universal masking, as well as if somebody needs to come in and needs to wait, we're modifying our waiting rooms to ensure that we're adhering to social distancing and keeping folks safe. In our facilities, as we bring back elective procedures, we're doing screening. So pre-op, we have a screening process in place as patients come back in, as well as preoperative testing. And so we're testing anyone coming in for elective procedure. Those are aerosol generating procedures. We want to make sure that patients are safe, as well as our frontline workers, our physicians and our nurses. And so, like many other businesses, we're preparing as we recalibrate and reorganize our workplace. We want to keep our associates safe, and we want to keep our patients, visitors coming into our facilities safe. And so with that, I'll turn it back to you, Missy.
Thanks, Bernie. I just really appreciate that. And I think maybe this is happening across the businesses. So if you think about that poll question that we had, where folks are, 81% of folks are where you're saying, recalibrating, to me, it sounds like you've done a tremendous job of completely standing up new processes, and yet you're taking them in stride. You're like, yeah, we set up virtual urgent care, no problem. So it's almost like Wisconsin humility at its best, that you're actually really doing incredible work to change all that you're doing, and creating touchless clinics and things like that. It's just really fascinating. Let me ask you one question that came across. What do you think about flare-ups that might occur, and how is Ascension preparing for those, especially with the, with your vast range of clinics and your geographical area?
Well, as I said, we've been open, certainly, and as we've sort of reopened what I call the healthcare economy, we're phasing in. We are really looking at it by the HERC regions. So when we see if we saw flare-ups, then we would work with our facility leaders and our clinics, and we may have to pull back on some elective things to ensure that our facilities are able to care for an increase in hospitalization rate. And so that's what we're watching. We're not going to take down our incident command. We're going to continue to watch the cases, the positive cases. We'll continue to watch at the facility level if that has any impact on our facilities, and we'll be recalibrating the business inside of our hospitals to ensure that we can continue to deliver safe care to our community, whether it's folks impacted by COVID or those that need to come into our facilities. I want to reassure the community and those that use our facilities and clinics that we can manage this as a healthcare system. And I know in talking to my fellow CEOs, they're also prepared and preparing their facilities to be able to provide care for the clinic. Again, whether it's somebody that needs to come into our facility that's impacted by COVID, or somebody that needs to come into our facility that needs to deal with their chronic care or any other care that they need, the Wisconsin healthcare systems will be ready to provide that care to them.
Great. Well, thank you very much, Bernie, for that. And thank you for reminding us that this week is is it Nurses Week or Nurses Day? I live right near the local hospital, and the last 3 days I've seen one of the nurses that I know walking into work. So when I see her tomorrow, I will tackle her and give her a big
give her a virtual hug.
Give her a big virtual high five and a hug. So we're going to move on to John Kreul, but before we do that, we have one more quick poll question for you all. And this is based on a question that has been included in the Oshkosh survey. So the UW Oshkosh has been working with WEDC and the Regional Leadership Council on a survey. If you haven't had a chance to do the full survey, there's a link to that in the web window there. And so I really encourage you to take that survey, because we keep learning from it, and it's really helping us inform us about what's needed. But in this question, we are asking, what are your most pressing needs? Is it regulatory relief, line of credit, new employees or staffing assistance, or renewed new access to customers? So if you have a chance to please answer that, and then we'll be able to move on to John Kreul and hear what's happening with Amcor. So we are, I could do the music, the Jeopardy music, but instead you should all just answer as quickly as you can. John, I'll call on you since we're going to head to you in a second. What are your most pressing needs as you look at this list, or do any of them fit what you're looking for?
Yeah, one absolutely fits. So with Amcor being an essential business, making sure we have employees and healthy and safe employees to run our business is a key thing that we think about every day.
Great. All right, I think we are ready to see the results. All right, renewed new access to customers. That is the call to open up and get moving on our economy. We all feel that pressure, absolutely. And then the other ones are pretty steady. So that's a pretty clear answer. I like it. It's helpful when you get that kind of clarity. So John Kreul is with us. John is the Vice President of Supply Chain with Amcor. So John, I'm going to turn it over to you. Please share with us what you've been seeing at Amcor in Oshkosh and what you all have been experiencing as far as redesigning and recalibrating and what you're working on.
Sure, thanks, Missy. Thanks so much for having me today. Yeah, I'm John Kreul and I work at Amcor out of Oshkosh. Before I go into my specific material here, I just, I think as we go through this pandemic, we think about some of the silver linings that happen, and I think there's a lot of positive things that go on in our community and our lives. And the one thing for me is, I have 4 adult boys and they're all home, and so we've been able to spend some really nice family time together. So that's my silver lining to share with the group here today. Amcor is a global packaging company with over 50,000 employees. In North America, we have 9,000 employees across 37 states, 37 sites, 15 that are in Wisconsin. So just about half of our employees in North America are in Wisconsin. We are a company that is essential package product, so food, the things, health and safety, we are part of that supply chain. Next slide, please. Our focus has been very simple through this pandemic, and we've had 3 core areas. First, to make sure we keep our people healthy and safe and their families healthy and safe. That is a core value for Amcor. We want to make sure we keep our business running. We produce essential products that people need each and every day. And we want to contribute to the COVID-19 relief effort. So we want to make an impact in the communities that we live in. So for example, we just launched, we just announced that we're going to contribute to every site around the world is going to make a $5,000 contribution to a local charity to make an impact. Next slide, please. Our North America footprint, which spreads across the nation, gives us flexibility and resilience to supply the essential products. If you overlay the COVID risks, of course, we've had to mitigate have different mitigation actions based upon where the location is. So for example, out east in the New York area versus Wisconsin would have different, potentially different approaches. In addition, globally, we've had our Asia partners have had different experiences, and there's a lot of global collaboration and learnings and sharings that are going on among the company to make sure we have the best practices going around the world. Next slide, please. Our approach, of course, starts with safety first. We've taken a very defensive posture to protect our people and our plants to keep our critical supply chain going. That's included business continuity plans. We have a 24-point confirmed case plan, return to work practices, we actually do practice response procedures to make sure when something does happen, we are ready to go. We err on the side of caution to make sure that our employees are healthy and safe. But each and every day we think about safety first to keep our employees healthy and safe. Next slide, please. Working and managing the supply chain has been very interesting over the last 8 weeks. We have seen rapid demand volatility for our products. America has been stocking shelves. For example, we make toilet paper for packaging that has had dramatic demand shifts. To manage the volatility, we put focus on 5 areas. One, of course, our people, making sure they're safe, having clear roles and frequent communication, partnering with our customers and suppliers to understand demand shifts and make changes, and we've had to make a lot of changes. Establishing guiding principles on how we're going to fulfill the supply. So for example, 2 examples would be we're going to produce products that keep consumers healthy and safe first. And a second principle would be to produce customers' core products first. So we make sure the basic needs are met across our nation. We also have a lot of end-to-end communication and collaboration. So we have weekly customer updates and 2 times a week employee town halls just to make sure we're getting information out and our customers, our suppliers, and our employees are informed. And then one of the things that we've really seen is dramatically reduced cycle times to make sure we're making adjustments. So for example, our monthly supply chain practices went to 2x a week for the first number of weeks of the COVID crisis. Now they are weekly. So we've had to have a lot of agility and flexibility in our supply chains to react to the ever-changing needs. Next slide, please. My learnings to date have been a lot. It's been quite a time to work in the supply chain, to be a supply chain professional. Learning something I already knew that me at our company. What we make matters, and they delivered. This makes me really optimistic about the future. So people are at the core, people make the difference. Beyond that, other learnings were resiliency. What actions do we need to do to keep the supply chain flowing? How we manage inventory, capacity, multiple sites. Trade-offs versus optimization. What is the total cost of ownership in the supply chain? What's the risk of underestimating demand or overestimating supply? Stop manufacturing, for example. End-to-end customer supply chain harmonization, working with our customers and our suppliers to make sure the end-to-end supply chain delivers the key products and services for our communities. And then the last one is technology, information, and automation. Do we have the right information to make the right decisions at the right times? And then how can we leverage automation to mitigate supply risks to keep our operations running? All of these are learnings that as we come out of this COVID crisis pandemic risk time is really, I'm going to take a step back and say, hey, how can we improve our business and make us more resilient as we go into the future? Next slide. The other option, or the other thing that we've been really focusing on for our focus is giving back to our communities. So we've made donations to every food bank in each community that we have facilities. We have additional COVID-19 relief efforts going globally, and we have product and equipment donations that, for example, we donated a number of N95 masks to local emergency services in our Shelbyville, Kentucky facility. So we're going to be very focused on giving back and making an impact in the communities that we live. Next slide. To finish up, the most important thing that we have at Amcor, again, is our people. And we really have to make sure we're showing gratitude because they're on the front. A lot of our employees are on the front line making the core products that we need to keep our communities healthy and safe. We just released a bright spot video thanking our factory workers. We sent a care package to 9,000 employees over the last week to say thank you. And ultimately what we make matters. And we really appreciate all our employees making a difference in the lives in the communities and the lives of every person in this nation. So thank you for the time, Missy, and you know, really appreciate you asking me to come and talk about Amcor.
John, thank you so much. I really appreciate how clear Amcor is on what the priorities are, to hear what you've already learned about it, and then of course the emphasis that you're giving on workers and the importance of our employees all around the state. I think that's going to end up being one of our biggest lessons, is really appreciating our workforce, really understanding that there are human beings who are moving between their families and the workplace, and are, you know, very thoughtful and caring. So I just really appreciate all that you just shared with us, and the clarity that you have with that. I want to steal some of it for for some of the things we're doing. We have about 13 minutes left, so I'm going to shift to Buckley, and then John and Bernie, I hope you guys can stick with us. We might have a chance for an ending question for all three of you, but Buckley Brinkman is the Executive Director and CEO of the Wisconsin Center for Manufacturing and Productivity. And Buckley, why don't you tell us what you've been working on, what you've been hearing from the manufacturing world, and what you're thinking about these days?
Sure. Thank you, Missy. I want to thank you and also the Leadership Council for the opportunity. This has been great to work with all of our partners across the state. As many of you know, the Wisconsin Center for Manufacturing and Productivity is the Wisconsin entry into the Manufacturing Extension Partnership National Network. Every state has one of these centers, and we focus on helping small and medium manufacturers, which make up 98% of the manufacturers, both in Wisconsin and in the country at large. So I have a pretty unique perspective in terms of being able to see what's happening at the national level, as well as seeing across the state. You may know us better by one of our two subrecipients, which is the Manufacturing Outreach Center at UW Stout up in Menominee, or the Wisconsin Manufacturing Extension Partnership that works down here in southeast Wisconsin. So we've approached this really, I've really enjoyed listening to Dr. Raymond and John and Bernie talk about the cooperative nature of what's happened here in Wisconsin. I think we've really approached this in terms of ands rather than buts. What that means is where we've looked for opportunities is our first instinct is to jump in and say, what can I do to help? And say, but I could do it better than that. And as opposed to jumping in that way, we've been looking at and how can I help that person be more successful? How can I help tie opportunities together? And where are there gaps that we can fill in? And I think we've done that exceptionally well here in Wisconsin when I compare what we've done to what the other states are talking about when we have those opportunities to talk. So the WMEP took a pulse survey the end of April. I'd like to share some of the results with you just to give you maybe a little bit of feel of where small and medium manufacturers are thinking right now. And one of my big concerns in all of this is safety. And I think everybody's done a great job highlighting how important that's going to be. And I think it's really a matter of literally a matter of life and death. And we're not talking about a community initiative. We're not talking about a fundraising drive where 60 or 70 or 80% is good enough. This really is going to require everyone to do their part to keep us safe, because one bad infection in a wrong place can overwhelm the system quickly. And I think it's important that everybody is taking their part. And with the guidelines that are coming out, both from the CDC and OSHA and the consolidation that the WEDC and the other partners have done, this is not a situation where you can throw up your hands and go, oh, this is way too complicated to address. If you watch the guidelines, if you walk through your facility, it'll take you an afternoon to get your arms around it. It may take a little longer to implement, but everyone can do it. So it's good to see in the first slide here that employee safety is the #1 concern. Next slide, please. So when we're talking about where small and medium manufacturers are seeing their business right now, as you would expect, 77% of them are seeing a decline. So we believe that somewhere between 65 and 75% of manufacturers are still operating in the state in some way linked to essential businesses. So you can turn to the next slide, please. They're working and they're working well, but they've also seeing that their backlog is shrinking, and that's what we're really worried about right now, is that the pipeline is quickly emptying, and we need to get suppliers back working again. Next slide, please. As you look forward, most of these manufacturers, this is a little bit to what John was talking about the silver linings that we've seen during this whole process. And what we're seeing is the better manufacturers have used this pause now to take a minute to think about what they've truly learned, and then how they can strengthen their operation during this pause and really come back strong as we move forward. So, manufacturers overall are seeing that this is going to, they're expecting their businesses to return to some form of normalcy within the next year. A surprising number, over 70% in this survey are seeing that. And, we hope all of that comes to fruition, because this has certainly been a disruption. And I think we're going to be in good position to balance both the economics and the health concerns in bringing Wisconsin back to life. So thank you for the time, Missy. Thank you for allowing me to be a part of this.
Thanks, Buckley. I really appreciate your joining us today and sharing this information with us. So I think we've got about 7 minutes left, and I'd like to open it up to the group and talk a little bit, kind of encapsulate some of the conversations that we've had. So Bernie and John and Buckley, where, as you know, you're going to turn off this webinar and you're going to turn your attention to it's Friday afternoon and you're headed someplace next week. Where is your focus now going forward? Let's start with Bernie.
Our focus is opening up for essential services that were closed during the safer at home, and as we responded to really preparing organizations around PPE and testing and staffing as we anticipated COVID cases in our community. So now we're focused on getting our clinics opening back up. So next week we'll actually be opening up 140 clinics where folks need to come in, can't get care using our virtual platform. Those clinics will be open up, across the state. And then getting our facilities ready. We're training our associates. We're ensuring we have the PPE as we start opening up more imaging capacity, surgical capacity. We're doing a lot of preparation and training.
Great. And do you feel like your patients are ready to come back and have those elective procedures? And are you scheduling those now, or are you going to start scheduling those next week?
We're going to start scheduling those next week. We're ready. We're doing outreach. So we sent letters to our patients just to let them know the processes we're going through to ensure their safety when they re-engage for essential healthcare services. So we're explaining everything that we're doing and just educating them. We want them to feel comfortable. We have had patients come into our facility seeking care non-COVID related. So
I think I might have just lost Bernie's audio.
Oh, I'm sorry.
Yeah, that's okay.
Sorry. I think I did that. We're going to be just trying to educate our communities. So direct outreach, general comments out in the community, as well as patient letters, and just to reassure folks, listen, certainly if you need emergent care, get to the ER, but also if you have other care, chronic care, things that you were considering doing before we were hit with COVID, please re-engage with your physicians. We're prepared to walk you through it, and we're prepared to care for you safely. And so that's what we're working on.
Perfect. Thank you. Thank you, Bernie. Buckley, what are you thinking about when you come into the office on Monday morning?
Yeah, we're working on two things. One is helping our small and medium manufacturers operate safely and effectively. So as we come out of this downturn, we're in position to be just as efficient and effective as we can be. And then the second piece is as we start to reopen Wisconsin, the demand for personal protective equipment is going to escalate. So we're working on how can we project what the total demand is going to be, and then figuring out some ways that we can actually meet that demand or help people meet that demand. So those are the two areas we're working on.
Great. Thank you, Buckley. And John, what are you thinking about on Monday morning?
Monday morning, absolutely continued focus on safety and what else we can do to make sure our employees are safe at work is going to be the top priority. Very focused on our customers to make sure we're fulfilling the needs of the supply chain for essential products and services. And I do think we are in a marathon here that we're going to have to figure out how we go forward, how we collaborate and communicate more effectively to move our businesses forward. So we're thinking a lot about that at Amcor.
Great. Yeah, I can't agree with you more. I think that the nature of this crisis has been such that we've been focused really on a day-by-day sprint almost. And at some point, we are going to need to collectively lift our heads and realize we've got a long horizon. And certainly from my position at WEDC, we're thinking about the long-term impact of this on the economy and really how do we regain that momentum. And I look forward to working with all of you to understand what we can do, how we can roll that forward. And I look forward to working with Regional Leadership Council. You'll see that slide here. We've got the contact information for all of these different organizations. I really encourage you to reach out if you're looking for guidance, if you have an idea, if you're thinking about things from your perspective and want to share that with us. It's an amazing network of folks that we have all around the state. You know, at times like this, as John mentioned, you know, you really start to recognize the importance of your workforce. You recognize the importance of your healthcare and your different industries, but also these networks that we've put in place in Wisconsin to help each other in times that are good and in times that are bad. And so we have a support network of economic development organizations. We've got chambers, we've got community banks and credit unions, all of whom are leaning in to really help our business community and our economy move forward. So with that, I'm going to thank all of you for joining us, Buckley and Bernie and John and Dr. Raymond, who's off on another meeting. Thank you all for joining us. We are going to continue this webinar series next Friday, 11 a.m. You all have been so kind to ask us questions and to participate with us, and we encourage you to keep coming back for these webinars. As we if we look back over the last 5 weeks, we have learned a ton, and as John points out, we got a long way to go, so we might as well do it together and keep learning from each other. With that, I offer you all enjoying the spring weather and staying warm as best as you can. It's a little chilly out there, but enjoy the weekend and stay safe. And thank you all for participating. Take care, everybody.
Thank you, Missy.
Thank you.
Thank you.
Thank you.